Good morning. Today, Saturday, November 21st, 2020. Today is our scheduled Saturday morning yoga therapy class. This we've been doing for a long time through Sattvic Space, Yoga and Healing Studio. Today's topic is yoga therapy as lifestyle medicine. Very important discussion and very important practice. In United States today, close to 50 million people are practicing yoga. And our research and our experience shows that about half of them are practicing because of underlying chronic health-related condition. Primary condition today, what people are practicing yoga as a therapy, is lifestyle-related disorders. Our another observation is people who are coming to yoga centers, even simple like YMCA, any yoga studios, any established yoga centers, in healthcare setups like even hospitals, outpatient therapy centers, almost or maybe over 75% of them are joining for underlying chronic health-related conditions. Lifestyle-related disorders today is regarded as the lifestyle what we have. What is the lifestyle we have today is called a fright and flight response. This is called stress. This is called fear of unknown. This is called a high sympathetic tone of our body. Remember, sympathetic tone, some tone which is sympathizing with me. We need that. Because that is called the eustress. Eustress, we need that eustress for us to function, for us to be active. When the eustress goes out of control, especially fear of unknown, these days, what will happen to me? What will happen to my coronavirus? What will happen to me if I'm traveling? Next weekend is a Thanksgiving weekend. 50 million people are going to travel. And our CDC saying, please don't travel. Traveling is a super spreader for COVID-19. What will happen to me when I go out? What will happen to me when my children goes to school? Constantly this hypersympathetic overdrive, it acts through your same system where a yoga practice causes taming. Taming means quieting down. That's the area. And the axis today is called, in the brain, it is called the emotional brain, which is the limbic system. Limbic system has two nuclei called amygdala and a hippocampus. Amygdala responds to fear, hippocampus responds to memory. It sends a signal through your neurotransmitters. Primary neurotransmitters today are called DOSE, D-O-S-E, dopamine, oxytocin, serotonin, and endorphin. A lot of other neurotransmitters sends a signal to hypothalamus. Hypothalamus is your place for homeostasis. It puts our body in proper order. It's like your default mode. It is like a reset button. Anything happens to our body, your hypothalamus will bring it back to a normal body physiological changes. Hypothalamus then sends a signal through your autonomic nervous system, primarily sympathetic and parasympathetic. Sympathetic is called fight or flight. Parasympathetic is called calm and digest. It literally creates a sympathetic overdrive with high heart rate, with a high blood pressure, high respiratory rate, your high blood sugar, contraction of the muscles. Why? Because it is a response to fear. Car is coming to me, animal is coming to me. It's a survival response. I need to either fight or I need to run away, flight. So both of them needs these hypercharged body. It also sends a signal through your pituitary gland, we call pituitary adrenal axis. Pituitary sends a signal to adrenal gland. Adrenal gland also sends some your hormonal output, which causes your altered hormonal homeostasis. Like our body hormone gets changed, and primary hormone what changes is your cortisol. Cortisol then transfers our end product of metabolism called glucose into a fat, which for your future energy, and the fat is stored in your abdominal cavity inside, not the underneath the skin. That fat is called a omental fat. Omentum. Omentum is the intra-abdominal fat. That omentum then acts as an endocrine organ. It secretes your pro-inflammatory molecules and it creates a state of inflammation. That inflammation then causes your diabetes, hypertension, heart disease, primarily a coronary artery disease, atherosclerosis, dyslipidemia, high cholesterol or high triglyceride and a low HDL. These are all your markers. So these are a syndrome called metabolic syndrome. And this metabolic syndrome is our lifestyle related disorders. On the other hand, a practice of yoga, which is a relaxation response, which is the activation of parasympathetic tone, completely your taming or a completely quieting down, completely calming the same pathway called psychoneuroendocrinology, and psycho means the limbic system, neuro is the hypothalamus, endocrine is your pituitary adrenal axis, also called psychoneuroimmunology. Our immune system gets better, so we can fight with our chronic medical conditions. Yoga as a therapy is a philosophy, it's a practice, which is called the 8 limbs of yoga. Yam is your social restraint, niyam is your personal restraint, asana is the seated poses, pranayama is a voluntary regulated breathing, pratyahara is a control of your 5 senses, dharan is the focus, dhyan is a meditation, samadhi is a union of your body, mind and spirit. So yoga means a union of your body, mind and spirit, and a health is defined as a balance of your body, mind and spirit. And a practice of yoga as a therapy will cause control of your disease and maintenance of your health. This maintenance of your health gives you all the benefit and acts as a lifestyle medicine. Yoga as a therapy is also your daily lifestyle. You maintain a yogic lifestyle, you have a daily practice, and you see that your blood sugar will start to come down, blood pressure will start to come down, your cardiac function test, we call it a myocardial perfusion scan, or you call it stress test, all will be start getting normal and normal and normal. But you have to do it. You take 4 medications when you have a metabolic syndrome, or maybe 6, sometimes 8. Instead of all the pills, you'll have to do a daily practice. And also this practice is very addictive. Once you keep on doing it, as I always said, you are not going to leave home without doing it. So let's see what is a yoga therapy as a lifestyle medicine. Very simple. You maintain a daily life when you get up and when you go to sleep, and you do a practice. You practice for simple 3 things, which is called the sign of health in yoga. First, called strong digestion. Whatever you eat, we used to say, look at the person. The person is what they eat. No, it's not the what they eat. Yoga says the person is what they digest. The food has to be digested. When the food is digested, it's converted into your body tissues, called 7 tissues, called Shapta Dhatu. Then it makes a substance called ojas. Ojas is your immunity. When the food is not properly digested, then it forms a toxin. In yoga and Ayurveda, it's called ama. The toxin is then measured in our blood, which as a Western medicine is regarded as a high cholesterol, high blood sugar, high uric acid, and all the metabolic disorders. So, strong digestion. For the strong digestion, we'll do few asanas, which will be all laying down. I'll show you those asanas. With the pranayama, Kapalbhati Pranayama, abdominal lock, Agnisar Kriya. Easy elimination. When you have a proper elimination, especially first thing in the morning, proper bowel movement, removal of all the toxic material from your body, you are properly healthy. And a dreamless good night's sleep. When you have a dream in the sleep, the dream in the sleep is not a good functional sleep. It's not a deep sleep. 2 kinds of sleep. One is called REM, rapid eye movement. Another called non-REM, non-rapid eye movement. It alternates. REM is 25%, non-REM 75%. Non-REM has a stage 1, stage 2, stage 3, stage 4. Stage 3 and 4 is a deep sleep where it does all your repair of the body. Stage 1 and 2 is almost 50%. So in a yoga practice, you get into the deep sleep. And how do you sleep? You sleep like a baby. The way the baby put their feet together, you do some pranayama, do some breath holding, and I'll show it to you slowly and slowly. First, what do? We get up first thing in the morning, and when you get up in the morning, we will generally turn on the left side and stay a little bit, and then slowly get up and sit down next to our bed. Remember, you have to create a little bit of a balance. Health is a balance of your body, mind and spirit. Once you get the balance, you try to sit down in a squatting pose. Very, very important yogic pose in the first thing in the morning. So you sit down in the yogic pose and then you hold a glass of water, primarily in a copper vessel, which generally we keep it in the nightstand. Then you drink the water in a gulp. So if you're practicing with me, see if you can sit down in this squatting pose. This is called your Makarasana. Initially, as I said, you listen to your body and you practice in stages. You may have to do it holding in the chair or holding into a wall, holding into a bar, but essentially you'll come into this position. And then generally the glass we use is your these are very nice copper glasses. This is a special name for this glass. Comes with the drinks. Anyway, copper has a special ion. That ion is like a target. It's a missile. Okay, there's a lot of importance of copper. From there, what you try to do in the morning, you sit down and then try to see if you can relax your whole body. Put your hands, separate your fingers. That separates your hand. Extend your wrist, helps your wrist. Put your one elbow inside, other elbow inside. Slowly bring your hands close to you. Keep your spine straight and sit up. Close your eyes, breathe out first. Take a deep breath in and breathe out longer than breathing in. Do it a few more times, at least 5 to 10 breaths, and within a minute you will have a sensation of your bowel movement. If you don't have any bowel movement, then yogic lifestyle gave us a kriya. It's called an action. Sanskrit name is called a shankha prakshalan. Shankha is Shankha. Shankha is a metaphor of your intestine, and prakshalan, Prakshalan, prakshalan means your proper cleansing. It is done generally with after about 3 months, 6 months, cleansing the body. You drink 2 glasses of water and you do 5 asanas. Don't have any bowel movement, drink another 2 glasses of water, do same 5 asanas. Another 2 glasses of water, same asanas. Slowly and slowly you will be seeing that you are almost going to have all the stool comes out and essentially all the water comes out. It's a wonderful practice. But for a daily, if you don't have any proper bowel movement in the morning, you can do 5 simple asanas, which I'll show it to you right now, and you will be able to see. In Sanskrit, it's called the Laghu Shankha Prakshalan. Laghu means mild. Shankha Prakshalan means you just do the asanas. The first asana is called a Sanskrit name, Shankha Asana. Shankha means it's called a Udar Karshan, abdominal massaging asana. When you massage your abdomen, you get into proper bowel movement. Also, when you're drinking the water in a gulp, It starts your peristalsis process. When you stretch your stomach, it contracts your colon, it creates a proper bowel movement. So your Shankha Asana is able to sit down in a squatting pose. Put your hands on your knees. Put your right knee in front of your left foot. Move your left knee towards your right side. Keep your spine straight. Breathe out first. Take a deep breath in. Slowly turn your body in left side. Do the same thing in the other side. Now you take your left knee, comes in front of your right foot. Right foot goes towards your left side. Body is straight. Breathe out first. Take a deep breath in. Slowly turn your body to the right side. Come back into your squatting pose, Makarasana. Then you get into, it's called your Oblique Cobra pose. You lay down slowly on your face down. You put your face down. In a Cobra pose, you put your feet together, but you separate your feet. The width of your mat, put your hands on both sides, slowly get up into a Cobra pose. Then look over your right shoulder towards your left foot and slowly come down. Get up again in a Cobra pose. Look over your left shoulder towards your right foot. This is number 2. Then from your squatting pose, sitting in a squatting pose, you get up without a support. When you get up without a support, be sure your body, your ear, your shoulder, your hip, and in the ankle, in the same line. This is called your Dandasana, or your body is like a stick, and that's the way you maintain. Keeping your spine straight is the most important healing substance in our body. Always walk, always keep your spine straight. Balancing, we are always comfortable putting our feet on both the sides. So if you can put your both the feet together and stand straight. I do in the morning, get body all the way high up. I also go against the wall. I go against the wall, and against the wall, I keep my body exactly touching the wall. My head, my back, my shoulder, my hips, and my ankle touching the wall. And my hands will go all the way high up. Put my hands like this, and keep my body like a stick. Third asana for proper elimination. Upward mountain pose. Untitled Chapter. Clasp your hand. Remember how the hand is flexible. You can do these hands all the way. Put down the head. Always breathe out first. Breathe out first. Take a deep breath in and slowly get your body high up. On the tippy toes and hand goes high up. Upward mountain pose. Try to stay, keep breathing. Breathing out longer than breathing in. And slowly come down. Again, people ask me all the time, how long I'm going to do the asana. All depends upon your practice level. If you're starting, listen to your body. No pain, effortless breathing. All the asanas, you'll feel like you are doing a savasana. Feel like you are totally comfortable and relaxed. The moment you get into a little bit of exertion, little bit of effort in breathing, it becomes an exercise. It becomes a sympathetic overdrive followed by parasympathetic activation. Yoga is primarily a parasympathetic activation. Breathe out first. Take a deep breath in. Slowly get your body higher. And able to stay here. Number 3 asana for your proper elimination. In fact, one of my friends who is a gastroenterologist who is using these asanas to prepare the colon for colonoscopy. When you prepare that, you get a proper cleansing of the colon to do the colonoscopy. But generally you have to do a little practice before, especially people who are practicing yoga, when they go for colonoscopy, they can be able to cleanse themselves with this asana practice. 4th asana, called Oblique Mountain Pose. Tirjak Tadasana. Put your hands high up. You can put your hands on the hand, on the high up, or another best thing is hold your one arm, put your other hand to hold your arm, and put your both the forearm on your head. This way you get more grounding. So you're not mobile too much. Breathe out first. Take a deep breath in. Slowly turn your body on one side and stay in this asana. Close your eyes and breathe. Breathe out longer than breathing in and stay here between 5 to 10 breaths. You will be seeing that once your breath gets more and more relaxed, your eyes are closed, you'll be sinking it more and more. Very interesting concept. That's the way you progress. That's the way you say, in stages, impossible become possible. Then when you come back again properly, breathe out first. Take a deep breath in. Slowly turn your body in the opposite side. Keep your eyes closed. Focus your attention to your breath. Breathing out longer than breathing in. Count of 2 in, count of 4 out. Wonderful practice. In fact, my friend of mine who's a gastroenterologist, he has done some barium meal study, extra barium meals, showing your intestine, showing in these asanas there is a proper contraction of the intestine to move your intestinal contents. Fifth one is called the west rotation pose, called Kati Chakra Asana. Separate your feet. Your hands on both sides. Left hand goes to the back. Right hand comes over your left shoulder. You breathe out first. You take a deep breath in and slowly turn your body all the way to the back. And able to stay in the pose. Remember, the pose will be in and out. You are not going to do a breathing out longer than breathing in. And slowly come back in the middle. Opposite side. This time, the right hand comes back into the back. Left hand over your right shoulder. Breathe out first. Take a deep breath in. And slowly turn your body in the opposite side. And stay in the pose. Stay in the pose. Breathing. Count of 2 in, count of 4 out. Slowly come back in there. You may not have a bowel movement in first few times, but you keep on doing it. If you keep on doing it, within a few weeks, you will see you'll have a proper bowel movement. 5 asanas for easy elimination. That is your lifestyle medicine. When you're standing up, another very powerful tool, yoga as a lifestyle medicine, is balancing your body, mind and spirit. Balancing physical body literally takes your balancing of the non-dominant side. What does it mean? I put my feet together. And I check my balance. I'm right-footed, right-handed. I'll see if I can balance on my left foot. And generally, my hands always fall when I'm trying to fall. So hand does a lot of balancing. If I take the hands balancing away, my brain gets a better signal from the balancing pose. Best way to do for the hand is called prayer pose to the back. I take my both the hands, take it all the way to the back, and do a slowly and slowly prayer pose to the back. People who are practicing with me, you have seen it a lot of times. This is the way the prayer pose in the back looks like. Then you'll be doing, you see if you can stand on your left foot. Stand on your left foot and see how long. 10 seconds. Feels like almost 10 years. 20 seconds. 40 seconds. Then you do one impossible task. It's called closing your eyes. If you can balance with closing your eyes. Initially it becomes almost impossible, but you can do it. Just one moment, I got a couple of messages here. Same thing, opposite side. Hands to the back. Now, do it on your right foot. And see, one side will feel better than the other side. So what you will do, the side which is not feeling better, you will do longer on the side. So for my case, I will do longer on my left foot than my right foot. I feel very comfortable. Initially, you may not be able to do it. When you do it, you hold onto a chair. Hold onto a side of your wall. And close your eyes if you can stay closing your eyes. Initially, it becomes almost impossible, but you will be able to do it. From here, you do more and more balancing poses. And once you get a master in the balancing poses, you can do a lot of balancing poses together. In fact, I'm showing you one. There's a little bit of advance, like when you do your, say, tree pose. Put your one foot on the top, below the knee, above the knee, and stay here. One thing you will notice, sorry, it's slippery here. One thing you will notice on the tree pose is that in a tree pose, you will feel a little different when you put your hands in front, and if you put your hands in the back, there will be two different feelings. Sorry, this is a little slippery today. Anyway, do the other side. Here, always try to put below the knee and above the knee. Put it above the knee. Put your hands in the back. It's called prayer pose to the back and a tree pose. And comfortable doing it, you will be able to do a Kapalbhati Pranayama, the breath of fire in this posture. We always ask you not to practice pranayama standing up. Pranayama causes altered sense of consciousness. So always say, do the pranayama sitting down in a chair, sitting down on a ground, or even laying down. For our little bit of an advanced practice, we are able to do it, and you will see when you listen to your body's signal, if you feel there is any altered level of consciousness, you don't do anymore. As simple as it is. So, we'll be doing a few more asanas, but in the meantime, once you have done in the morning, in a morning rituals, and now we are doing good. After proper bowel movement, you will be doing your brushing your teeth and tongue scraping. Tongue scraping is very, very important. Tongue scraping is very important because your Let me see if I get in some tongue scraper. You have a beautiful tongue scrapers, and you need a tongue scraper. People does with your brush. Really, the brush doesn't help too much. So I have a bunch of here tongue scraper. You can use a simple you can use a simple plastic tongue scraper, and you can go back to the back of your tongue, and slowly you can bring it down. Sorry, let me go back to my... They're very simple plastic. You can also have a steel, this little curve, all the way to the back, and slowly. The tongue, or the coating in the tongue, when you put a food in your mouth doesn't know whether it is a protein, fat, or carbohydrate. Mouth only knows the taste. So once there is a coating, it cannot feel your taste. Some of this metal one comes as a pre-bend. Still, you can take all the way to the back of your tongue and slowly scrape. Generally, don't do too rough scraping. Just a very gentle, simple. Copper ones. This is a very nice one. I just got one a few years back for my collection. You can put the copper one in the back. Next, you always do, as a yogi, we've been doing it for years and years, we always do a neti pat, or washing our nose. Neti pat is very important, and you can buy now anywhere, in any place. You can get one of the neti pat. Neti pat will look like this. This is like a simple pot. You put a little lukewarm water. And then you put a little salt, which is your non-iodized salt. When you put a non-iodized salt, and then very gently, initially, you put it on your nostril. Initially, you may have a little bit of a difficulty. You can put a little bit of a Vaseline, put it on nostril, and then close your eyes and turn your head, open your mouth, and let the water run very smoothly. Initially, it may not run properly because you do have a little bit of a tightness and little swelling. When you get a little bit of a tightness, when you have a little bit of more of your, we call it a little bit of irritation. It irritates, you get a lot more swelling, water may not come out. More and more you relax, water will come out very simply. What you need to do, close your eyes, open your mouth, breathe through your mouth. And I have a lot of things being demonstrated before. You can go to my YouTube channel, you'll be able to see it. Same way, you fill it up with the lukewarm water, put about 3 pinches of non-iodized salt, put it on your nostril, turn your head, it'll come out. People are very creative. I have seen, I just got one, made of copper. This is a neti pat made of copper, and apparently the copper has some iron which helps you. Many of the hospitals are using it. Copper impregnated hospital, your bed sheet, bed covering. In my hospital here in my town, it's called Centera Hospital. They started using it for a long period of time. And after that, traditionally in yogic lifestyle, they will do a oil massage. They'll do the oil massage for your body, which is called Abhangam, is a self-oil massage. And after self-oil massage, they will take a shower, they will take a shower, they will get cleaned up themselves, and after the shower, they will do their morning practice. Morning practice generally we recommend, initially you do according to your timing, but once you can do it properly, you do up to an hour, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. The practice generally includes a relaxing asanas in stages. You sit down, like if you sit down in a cross-legged, you will sit down, you will be sitting, you put your feet under your knees, cross it, keep your spine straight, then use your hand, called hand mudras, touch your index finger and thumb, close your eyes, then you will be breathing out longer than breathing in. Generally first you do breathing out first, 2 seconds in, 4 seconds out, and slowly we'll practice 4 seconds in, 8 seconds out, 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out. We've been doing so long, we can easily do 10 seconds in, 20 seconds out. Once you do this breathing out longer than breathing in is sympathetic, breathing out is parasympathetic, you enter into a profound level of relaxation. For a daily yogic lifestyle practice, what you do is called a bumblebee breathing. Bumblebee breathing is very, very important for daily practice. What it is, our five senses creates a state of stress. And also, when you are doing like this, change your foot, cross your feet. When you cross your feet, you are going to create the balance. You'll see you feel better on one side. The side you feel little uncomfortable, you continue a little longer on that. The five senses, I hear, I see, I smell, I taste and touch, keeps me awake, alert, active, and let's create a proper sense of stress. Shut down your five senses. Brain has a frequency, and you create another frequency. Two frequency interacts and cancels. It's called a bumblebee breathing. Quiets down your mind. It literally is a treatment for your stress-related disorders. You do 3 times, 5 times, sometimes 7 times, 10 times a day in the morning practice. Let me show you a couple of times, and if you are doing with me, you can also share with me. Both put your index finger in the forehead, close your eyes with your hands, close your ear with the thumb, close your mouth. You'll always do the breathing through your nostril. You breathe out through your nose first. You'll breathe in and breathe out with the sound of a bumblebee. Then the palming and cupping. Do some palming. Rub your hands. When you feel the warmth in your hand, If you're wearing glasses, remove your glasses, put your hands over your eyes. Let the hands take all the, eyes take all the heat from your hand. That it relaxes your eyes. Eye is a direct communication with your brain. Eye is a part of brain which is outside your skull. Massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, front of the ear, the tragus, external ear canal. There is a branch called auricular branch of vagus nerve. And vagus nerve is the activation of your parasympathetic tone. Take your hands in front of your neck, massage your carotid sinus. Carotid sinus is at the bifurcation of the carotid artery, which is activator of your parasympathetic tone. Slowly relax your back and feel a profound level of relaxation. Every day you do a little bit of a very gentle relaxer of your hand, like your hand, you do your, like a baby fist, thumb inside and close. You do your shoulder, you rotate your shoulder. We have sewn in front and the back. This you continue. You continue this for a daily practice. You do your neck, you do your feet, especially you like to do your separation of the toes. I've done one practice yesterday. I showed you what the separation of toes looks like. Very, very important. The feet as a lifestyle medicine. See, when the feet is not happy, you get into a tremendous amount of your sympathetic overdrive. Pain, remember, pain is sympathetic. So the foot has a separation, like I put my finger, separate my toes. See, when the toes are separated, the feet is relaxed. When the feet is relaxed, there is no much even symptoms. Yesterday I did a class, but that was in Bengali, called peripheral neuropathy. And peripheral neuropathy, you wear different kind of shoes. We have yoga toes, yoga socks, yoga shoes, supporting your arch, separating on your toes. I've shown it yesterday. I think I still have it here somewhere. Yeah, let me show you a couple of shoes which you wear that gives you a very comfortable relax throughout the whole day. Remember, yoga therapy is not what you are doing for 1 hour, what you are doing throughout the whole day. So there's a different shoes which you use. The moment your feet are relaxed, your body gets relaxed. The body gets relaxed, like this is the way. Now what I will do, I'll put my one foot on the top. This is called your half lotus, Ardha Padmasana. Sitting here, I always also separate my toes. So it's a wonderful practice if you keep doing it. This is the shoe. It's called a Birkenstock. It has a arch support, and you can see in the end it's very well separated. All of your toes get separated, and this arch is made of a cork, and it has for years and years. I have it probably 25 years, and when you wear it more and more, it molds. It molds along your arch. So your arch is supported, you are separated, and when you put both the shoes together, it is a wonderful yogic lifestyle. We all yogic wear, therefore a comfortable foot. A few of the shoes. This is another interesting shoes. This shoe has your called acupressure point. Your feet has all the acupressure point. This points activates your different organ. So inside the sole, it has the activation of the acupressure point. It also has the arch support. It is a nice dress shoe, but it has a walking sole. So you can bend the shoes, you can walk. This is really comforting your feet and keep your feet relaxed. In the same way, another shoe which has 5 zones. 5 zones of the shoes. This is called, you can see, it is called 5 zone. And a 5 zone is all the five areas on the sole of the feet, which you get a pressure when you're walking and supporting your arch. Very, very important concept. Relaxing. Then the very important is your igniting your Agni. It is a very, very powerful experience. You need to do and most important, igniting your Agni is all the asanas, all the massages, which is towards your belly button. We come to age, we are doing all kinds of practices, but still get a little bit of your truncal obesity. This truncal obesity can help, but still, when you put your hand here and bring your feet here, touch tip of your middle finger at the level of your belly button, you are still is in a range of not having too problem with the truncal obesity. So first you laying down practices, few asanas which will be centered around your belly button, which will be your igniting your Agni. Say proper elimination and a strong digestion. In a strong digestion, you will see first when you lay down, you slowly lay down and be sure your head and slowly touches your ground. If you don't feel comfortable, you may put a little folded towel or a very small pillow to keep supporting your head. Put your hands on both sides, palm facing high up. And then put your feet together. First simple asana is your feet raising. Slowly raise your feet, not too much, about 30 to 45 degrees, and stay in the posture. When you stay in the posture, when you continue your breathing out longer than breathing in, slowly and slowly, you feel the effect of it. It tightens up your stomach. It activates your digestive fiber for proper digestion. Feet raising, patho-physiology. From here, you can do your boat pose. From here, you can do your Makarasana. You put your whole body in the shape of a boat, put your hands on both sides, and you can feel that you are having a little bit of a shaking, but it will go away. Feet raising pose. Boat pose. Then your knee chest, Pavan Mukta Asana. You put your both the feet together, bring your nose touching your knees, then your chin goes in front of your knees. Slowly, you can turn on both the sides. You also can do front and back, all the way to the back. I'm just showing you how to do it, but when you do practice, you keep practicing in stages. When you'll be able to do about 10 breaths, between 5 to 10 breaths, it's a very good time. If you look at a one yogic breath, 2 seconds in and 4 seconds out, it's about 6 seconds. So 5 breaths will give you 30 seconds, 10 breaths will give you about a minute. It's a nice practice. Bend your knees, put your feet together, Makarasana, monkey pose, or stomach revolving asana, Jata Parivartanasana. You look at your, both the hand goes outside like a T. You look into your left hand and slowly drop your both the knees on the ground. And most important thing here is able to stay in the pose, able to stay in the pose completely in an effortless ease, and completely as if you will be able to sleep in the pose. Very important for improving your digestive fire. Slowly come back into the middle. Now to the opposite way. Look into your right hand. Slowly drop your both the knees into opposite side. Let me show you about 5 breaths, what 5 breath looks like in a yogic breathing. It's a beautiful 5 yogic breath. Slowly come back into the middle, and you are in a profound level of relaxation. It's a wonderful practice. This is also improving your digestive fire. Makarasana. Setubandhasana, bridge pose. Separate your feet up to the width of your shoulder. Touch back of your heel with the tip of your middle finger, and slowly raise your body high up and clasp your hand and keep going high up. Once you're comfortable, stay in the posture. Again, what your body will allow you. Not to compete with anybody, but to reach for your final goal between 5 to 10 breaths. And then if you can raise your one foot, it gives you balancing poses, balancing your both pose. And slowly you come down. These are the asanas to improve your digestive file. Very, very important for your daily practice and daily yogic lifestyle. Next one, let's see if you are relaxed enough. You can do a called feet touching your nose and your forehead. Patho-physiology Asana. Very important asana to ignite your digestive fire. Take the other foot, bring it up, touch it to your nose, then to your forehead. Every asana you do, whether you are laying down, whether face up, face down, standing, sitting, you will feel like that you are in a profound level of relaxation. You really don't need a counter pose. You don't need any savasana. Every asana is a savasana. You can do a Shavanga asana, shoulder stand. You can do a plow, halasana. This all helps for your digestive fire. You can slowly go back and get up into a Sarvanga asana. If you're comfortable enough, you can do a lotus pose on a Sarvanga asana. Padmasana on a Sarvanga asana. You can do all the way high up and slowly get into your plow, halasana. Another very nice asana you can do for your igniting fire is putting a little bit of more stretch and more massage of your abdominal content. You hold on to both of your knees like a knee chest, Pavan Muktasana, but instead of bringing the knee in the front, you get your head high up and slowly You drop your feet on the ground. Now your feet is grounded. You're holding onto your knees. And you're breathing completely effortlessly. Slowly relax yourself and put your head down. We'll show you asanas to practice a dreamless good night's sleep. Remember 3 signs of health: strong digestion, easy elimination, and good dreamless sleep. Before going to sleep, you act like a baby. You will sleep like a baby. You will see what the sleep baby does, and you see how the baby sleeps. And you incorporate some voluntary regulated breathing for your proper sleeping. First, you do a very simple asana, which is called your happy baby pose. Ananda Balasana. In Ananda Balasana, you raise your both the feet high, hold your big great toe, straighten up your knees, and slowly separate both the feet and bring it back. You'll be seeing the babies do it all the time. They'll hold their toes, they'll separate their feet as much as it goes down, and bring it higher. Ananda Balasana, happy baby pose. When you sleep, how do you sleep? Sleep like a baby. What are the rituals you do for sleeping? First, you have to remember you sleep through your nose. You do not sleep through your mouth. What does it mean? It means that all the breathing has to be through your nostril. You don't breathe through your mouth. So how to do it? Remember what happens inside your nose. There is a mucus, and when you're sleeping, the mucus dries up. When it dries up, our nasal opening is very small. When a nasal opening is very small, it gets blocked. Start breathing through your mouth, and the mouth breathing causes snoring. Snoring causes sleep apnea, and you don't sleep at all. You do not have a good night's sleep when you breathe through your mouth. How do you know you're breathing through your mouth? Wake up in the morning, your mouth is dry. So at night, before going to bed, you floss your teeth, brush your teeth, then you do a little oleation of your nostril. You took a little oil and put a little oil inside your nostril, Or you can take an oil in your finger. It's a private practice, and you can massage inside of both the nostril. When there's an oil in the nostril, the mucus there cannot get dried up. Your nose stays open. There's a lot of gadgets in the market. You can close your mouth. You can even tape your mouth. But those are very not a good practices, because many a time during sleep you do have a little yawning. Yawning is a part of your sleep, and the tape in the mouth will prevent you from the yawning. Many a time you have a little cough during your sleep, which are entirely normal. During sleep also, if you wake up, if you get up, go to the bathroom, if it is within 20 minutes, it does not interfere with your sleep. So, now we are getting into the bed. Be sure you are comfortable. If you have a little discomfort, you can put a little rolled towel or rolled bed under your waist, under your neck, or under your knees at the beginning. Be sure it's a rolled towel so that slowly and slowly you can unroll it and able to take out. Baby sleep, which is called a Supta Baddha Konasana. They'll put the feet together and drop their knees down. This is the way baby sleeps. Then you will see baby sleep in a relaxed state. You'll see baby will sleep with the hands. It's called the baby fist. They put the thumb inside and they close. And exactly want to sleep like a baby. So do that. You put your feet together, and initially, if you're a little uncomfortable, what you can do a supported, like a supported Supta Baddha Konasana. You can take two small pillows, put it on both sides. Same way, we're going to sleep. If you put something under your head, it's okay. Look at Supta Baddha Konasana. If you cannot put your knees down, put your two sort of pillows. Have your hands in this baby fist. And if you have a little oil in your both the nostril, you will feel sleep in a reasonable time. There's a time lag in sleep. Most important thing, yoga therapy as a lifestyle medicine, is your good dreamless sleep. Without this, you are not going to be able to lower your blood sugar. You are not going to be able to lower your blood pressure. You are not going to improve the perfusion of your heart, relaxation of your coronary arteries. When you go to bed, if you fall asleep right away, you are sleep deprived. It takes about 10 to 30 minutes of a lag time for you to fall to sleep. So generally after 10 minutes, you start to get into sleep. If you cannot fall asleep after 30 minutes, you are developing insomnia. Then you look at a baby, how the baby is sleeping. When the baby sleeps, they're so relaxed, they will do an abdominal breathing. There are two kinds of breathing, chest breathing and abdominal breathing. Abdominal breathing is relaxing. Abdominal breathing is your parasympathetic tone. Excuse me. So, with your hands in the Adhi Mudra or baby fist, you practice. Put your hand on your belly button. When you breathe in, your stomach wall will rise. When you breathe out, the stomach wall will come down. Keep on doing it a few times, you'll feel a profound level of relaxation. Supta Baddha Konasana. Then if you can do it a little bit higher up, keep the feet higher up a little bit, put both the pillows high up, drop your feet down. Another way, it is the beginning of your sleep. Hands again in a baby fist on the side of your body. Then you incorporate your breathing. First, breathing out longer than breathing in. Generally about 5 to 10 breaths. A simple count for us is very simple. We can do count of 5 in and count of 10 out. Breathe out first, count of 5 in. Count of 10 out. Count of 5 in. Count of 10 out. Continue about 5 to 10 times and you'll feel a profound level of relaxation. Always breathe out longer than breathing in. Then we'll practice your breath holding. Breath holding improves what is called a carbon dioxide narcosis, CO2 narcosis. What does it mean? When you hold your breath, body is not eliminating carbon dioxide. Carbon dioxide goes higher in the blood. It's called a carbonic acid, which acts like your sedative, narcotic. That means it is very calming, cooling, and puts you to sleep. Generally the practice is 1:4:2. Count of 4 in, count of 16 hold, count of 8 out. It is slowly increasing. Count of 5 in, count of 20 hold, count of 10 out. When you get better and better in breathing, remember, the whole breathing is through your voluntary muscles. So you always can improve your breathing function. So let me show it to you. The first, again, my hands are always in that baby fist, thumb inside and close. First you breathe out, count of 4 in. Hold it for count of 16. Breathe out to the count of 8 out. Now I can increase a little bit more. At the count of 5 in. Hold it for count of 20. Breathe out with the count of 10 out. You can stay here, continue about a few times, 5 to 10 times. If you could at it better, you can do count of 6 in, count of 6 in. Hold for count of 24. Breathe out to the count of 12 out. In a short time, you'll feel that the eyes are closing, you're getting into sleep. But first, you try to sleep like a yogis on your right side. Yogis don't have any pillows. They sleep like a fetal position. They bend their feet. They use their one hand like a pillow. For me, I also sleep like this, but what I do, I put a pillow. My head will be on a pillow, small pillow. Then I take both the hands, I put it hands close to my knees. This is a balance. In a during sleep, your body's inside core temperature comes down. All the muscle gets relaxed. Initially, your body's inside temperature is still high. When you sleep on the right side, your left nostril opens up. When the left nostril opens up, left nostril is cooling. It is a moon energy. It's slowly balancing the heating energy for inner core of your body. You'll feel the effect of relaxation. You'll slowly go to sleep. When you get into the sleep properly, then you turn into your left side. You turn into your left side and go to sleep. Let me show you from the other way so you'll be able to see how to sleep on your left side. Now I'm sleeping on my left side. My right nostril is opening up. Now my body's core temperature is going down. Right nostril is little heating. And creating a balance. Brings a profound level of sleep. Mouths are closed, breathing through your nostril, falling asleep. Going to get up, slowly extend your right leg, support your body with your hand, and slowly get up. When you get up, again, you sit down into a squatting pose, Makarasana, drink a glass of water, then you do all the steps which we have shown it to you. Tongue scraping, washing your nostril with the Neti pad. You will be doing a daily practice of your pranayama. Asana practice is a must. Asana primarily is a relaxation response. You keep your body completely relaxed. Very, very important concept of asana. Asana is not going to in and out of a pose. When you go in and out of a pose, it becomes an exercise. It becomes a sympathetic overdrive. In a pranayama practice, your first practice is lung is like a balloon. It has a 4.5 liter capacity or vital capacity. We only breathe 0.5 liter, 500 cc. You learn how to breathe out. Then you take a deep breath in completely effortlessly. Then breathe out longer than breathing in. Continue that. That is the first. You're preparing your lung. Then you do your first a stepwise pranayamas. These pranayamas I have shown you in the practices. It is in the pranayama. You can go to my YouTube channel. You'll see. I'm going to name it to you so you'll understand. The first pranayama will be your Bistrica Pranayama. Bistrica is a balance. It is a gateway of pranayama, and you need to continue that. You need to continue very slowly. You need to continue very medium pace, very rapidly, and you can do a raising your hand in a slow speed, medium speed, high speed. Then you will do a Kapalbhati Pranayama, your breath of fire. You will push your stomach in, let the air comes out. It massages all of your abdominal organs. That you will be also doing. Remember, you all do this thing completely effortlessly. When you can do that effortlessly, that means you can talk, you can breathe, You can even sing. Then you do the first bellows for about 2 to 3 minutes. You do Kapalbhati Pranayama. Kapalbhati means Kapal is the forehead, Bhati is the shining. There is a lot of ways we do Kapalbhati Pranayama with all the hand mudras. These are all in my pranayama practice. Please take a look at it. Then you do alternate nostril breathing. Alternate nostril breathing, left nostril is controlled by the right brain is intuitive, and right nostril is controlled by the left brain is analytical. Left brain is heating, right brain is cooling. Left nostril breathing is called Chandranari, right nostril breathing is called Suryanari. Sun energy, moon energy balances. You do the Bumblebee Pranayama, Bumblebee breathing, do Ujjayi Pranayama, Sitali Pranayama, Sitkari Pranayama. You daily do about 5 to 7 pranayamas daily. But once you do the pranayama, you do your Uddiyani Bandh, abdominal lock, the chin lock, the root lock. Once you complete that, you will feel that you're totally entering into a state of meditation. So if you're practicing with me, let me show it to you as steps. This is just the technique, just to show it to you how to do it. But you'll be doing it a little longer and longer. Like first, you will be doing a simple Bistrica Pranayama. Very simple, you can raise your hand high up. Breathe out first, take a deep breath in, and actively breathing out and slowly pull it down with your baby fist. Very simply active inhalation, active exhalation. You can do it a little faster. You can bring it up. You can do raising your hands high up in a very slow pace. You can increase the speed a little bit. You can go to medium speed. Medium speed will look like this. Always do the eyes closed. Bring your mind close to your breath. Very important. This is the beginning of your pranayama. You can do very rapidly. Remember, it has to be breath has to be completely effortless. When you do very rapid, it will look like this. You might get some drainage will come out through nostril. When you get that, entirely normal. Don't have to worry about too much. Just 1 second. Very nice. When you relax, you can get into this Padmasana, the lotus pose, very easily. You could do this also sitting down, very slow, very rapid. Slow you do. Put your hands in a Baby fist. So I'm talking, I'm breathing, I'm totally effortless. I can do in hundreds and hundreds. I'll still have no issue because I practice every day. You can do very rapidly on this one also. So let me show one sample. When you do very rapid Bistrica Pranayama or a bellows, you will see that you get washing away of all the carbon dioxide, and gets a lot of oxygen comes back. And always practice little breath holding. So the rapid Bistrica Pranayama will be I did 100, very easy. I can do 400, I can do 600 without completely effortlessly. Most important yogic lifestyle is able to learn how to do a breath holding. Breath holding is a very, very important yogic practice. You will be doing breath holding both in inhalation and exhalation. The way you will do it, you will do it count of 4 in, count of 16 hold, count of 8 out, and count of 8 hold. Inhalation, retention, exhalation, suspension. And longer you'll be able to do breath holding. Better and better your health is going to be. I see apps now. This app shows that if you can hold this breath from point A to point B, you don't have any coronavirus. Your lung function is good. Breathe out first. It's a count of, just a little bit more. It's a count of 10 in, and then hold enough, breathe out and then breathe hold. Just let me show you a count. And when you do the breath holding in inhalation, drop your chin down, touch your chin touching your chest. It's called the Murcha Pranayama. I did a breath in, and a breath hold, breath out, and a breath hold. Inhalation, retention, exhalation, suspension. Longer and longer you can do, better than better. Yogic says it's called it Mrito Sanjivani. Mrito means dead, Sanjivani is awake. It wakes up a dead person. I practice every single day, breath holding. In a Kapalbhati Pranayama, you just put your awareness in the belly button, keep your spine straight, eyes closed. Easily you can do 50, 100, we do about 500, 1000, we do 50 in each mudra. Dhana mudra, Vayu mudra, Shunna mudra, Prithvi mudra, Purun mudra, Shakti mudra, Prana mudra, Apana mudra, Apana Vayu mudra, Linga mudra. In alternate nostril breathing, you just simply close your right nostril. Don't have to do too far. Just go underneath, breathe out through left nostril, put your left hand in a Dhyana mudra. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger. Breathe out through right nostril. Breathe in through your right nostril. Breathe out through left nostril. Left nostril is controlled by right brain, which is cooling. Left nostril breathing is called cooling, moon energy. Parasympathetic. Right nostril is controlled by the left brain, which is heating. Right nostril is called a sun energy, sympathetic. Slowly you put your index finger and middle finger in your third eye, close your eyes, bring your awareness to your third eye. Continue your alternate nostril breathing. Left hand, hold it to your right earlobe, it balances. You can look at all the pranayama practices on my YouTube channel and see how long to continue. I practice every single day pranayama. Very, very important practice. How long? We do it about 5 to 10 minutes, and when you start it, until you have an effort in breathing. Bumblebee breathing, which I already shown it to you, index finger in the forehead, all the three fingers, close your ear, close your mouth, breathe out through your nostril first. Pumping and cupping, rub your hands, you're feeling warmth in your hands, wearing glasses, remove your glasses, put the hands over eyes like a cup, Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face, your ear, back of your ear, front of your ear, tragus inside this is the auricular branch of vagus nerve. Bring it down here, massage your carotid sinuses, massage your back. You do Ujjayi Pranayama in a very relaxed way. When you Ujjayi Pranayama, you'll see you will develop a abdominal lock, Uddiyani Bandh. Then you create your chin lock, Jalandhar Bandh, and then you breathe through your left nostril. Totally comfortable and relaxing parasympathetic practice. Let me show you one time. I've shown it multiple times. You can see it a little bit more. You can see how to do it. Hands in again in Adhi Mudra. Breathe out first. Take a deep breath in. You can always do with your vibrations. You can do with the Brahmari Pranayama, you can do A, U, Ma, you can do a Pranaho Pranayama. But best meditation is, meditative pranayama is your meditative alternate nostril breathing and focusing on your breath. What does it mean? We have a gross body, we have a subtle body. Subtle body is the body of your mind. Our subtle body is the one body which we can access anytime. Like for here, my eyes are closed, I can exactly see my whole body. I can touch tip of my nose, I can hold into my left big toe, can touch my right knee, touch my head, touch my belly button, touch my left shoulder, right shoulder. Same way I can concentrate on my breath center. I can concentrate and do an alternate nostril breathing without closing my nostril. I do it in a silence, and that is a profound meditative experience. When body is prepared, body is completely relaxed, your breath is completely effortless, you slowly enter into meditation. You don't want to do a meditation. Meditation will come to you. Hand in a Dhana Mudra. I am in a lotus position. Spine is straight. Bring your awareness in your breath. Visualize the breath is coming through your nose. Visualize the nose is like your personal air conditioner. It is your filter. The air is getting filtered. Outside air is warm, it is getting cooled. Outside air is cool, it is getting warm. Air is going into the side of the nostril, which is called turbinate, which is guiding the air to go to the larynx. In the process, it is secreting a substance called nitric oxide. Nitric oxide is activator of your parasympathetic tone. Going through your larynx, behind your throat, coming down into upper part of the lung, middle part of the lung, lower part of the lung, at the level of your belly button. Hold your breath in the belly button for a short time, which is called a cable kumbhak. Then visualize your breath is coming out, lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Breath is a carrier of prana. Prana is a subtle energy which keeps us awake, alert and alive. Breath is the carrier. Prana is like electricity. Breath is like electric cable. Visualize breath is picking up prana. Our whole body does healing, not only lung. Breath is bringing prana inside through our nostril, inside our body, and you're guiding the prana to the organ of healing. For me, I have some heart problem. I'm visualizing prana is coming to my heart, causing pranic healing. If you have diabetes, you visualize prana coming to your pancreas, healing your diabetes. If you have a high cholesterol, you visualize the prana is coming into the blood and the cholesterol and reducing the cholesterol. Slowly and slowly, you silently bring your awareness to your nostril. Breathe out through your left nostril. Then breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. I'm clearly see I'm breathing out through my left nostril. I'm breathing in through your left nostril. Breathing out through the right nostril. Breathing in through my right nostril. I continue this in a silence. For your practice, you'll silence. Once you do it, you'll feel the tip of your finger will get numb. You'll feel the capillary pulsation which shows you that you are entering into a state of meditation, transcendental state. At home, you continue longer and longer. Finally, bring your hands in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger, called a Lotus mudra. Keep it in front of your heart chakra. Slowly bring it in front of your heart. Yoga therapy is a lifestyle. It corrects all the lifestyle-related disorders. Lifestyle-related disorders cannot be treated with pills, cannot be treated with a medication. We are trying. Using called a poly pill. You might look into it, what a poly pill means. 4 medication is 1 pill. Aspirin, statin, beta blocker, ACE inhibitor. The whole yogic practice acts like beta blocker, ACE inhibitor, aspirin and statin. It corrects all of your lifestyle-related disorder. Lifestyle-related disorder should be corrected with a proper lifestyle. Put your hands in front of your heart chakra again. Finally finish with another round of relaxing response, humming and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth, remove your glasses. Put your hands over your eyes. Let the eyes take all the heat from your hand. Massage your forehead. Massage your eyes. Massage your face. Behind your ear, front of your ear, tragus, external auditory canal, your carotid sinuses, and the back. It's a wonderful practice. Yoga therapy as a lifestyle medicine. Please keep on practicing, and we can guarantee you within 4 to 6 weeks, maybe a little longer, and it varies from person to person. Maybe somebody in 2 weeks, maybe somebody in 2 months, you'll get a profound level of changes. Next Saturday, next weekend, is a Thanksgiving. Thanksgiving is a wonderful family holiday. I know we have been a tremendous CDC recommendation not to travel, but still 50 million Americans are traveling, creating a lot of stress, lot of lifestyle-related disorders. Thank you. for participating. We'll see you again. We'll see you in 2 weeks. That will be your December 5th. We'll see December 5th with another edition of Saturday morning yoga therapy class.